Hello, everyone. Welcome to your Infection and Asepsis lecture. We're going to be talking about a lot of things like the infection cycle, how to break the cycle, asepsis, standard and transmission-based precautions. Just remember, it is important to understand infection and how to prevent them. Understanding the types of asepsis will help to ensure to prevent infection in patients. This is in any setting, whether it's a hospital, long-term care, clinics. All this information is to assist in the prevention of infection. By the end of this lecture, you're going to be able to explain the infection cycle, list the stages of an infection, identify patients at risk for developing an infection, describe nursing interventions used to break the chain of infection, identify situations in which hand hygiene is indicated, identify multi-drug resistant organisms that are prevalent in hospitalized patients and community settings, describe strategies for implementing CDC guidelines for standard and transmission-based precautions when caring for patients, and then implement recommended techniques for medical and surgical asepsis. So what is an infection? An infection is a disease due to the presence of a pathogen. What a pathogen is a disease-producing organism in or around the body. An infection occurs as a result of a cyclic process consisting of 6 components: infectious agent, reservoir, portal of exit, means of transmission, portals of entry, and susceptible host. The components of the infection cycle, like mentioned in the previous slide. So the infectious agent, it's bacteria, viruses, fungus or fungi. A reservoir is, natural habitat of the organism, where they live, where it thrives. Portal of exit is point of escape for the organism. Think of cough or feces. Those are portal of exit. Means of transportation, so it can be direct contact, indirect contact, airborne route. So this is how the pathogen travels to get to a portal of entry. Portal of entry is the point in which the organism enters the new host. And then the susceptible host hopefully can overcome and be resistant to the pathogen that is trying to invade. So let's look at the infectious agents. So bacteria is the most significant and most prevalent in hospital settings. Viruses are the smallest of all the microorganisms. Fungus or fungi are plant-like organisms present in air, soil, and water. And then one that I didn't mention was parasites that can live in the host. Think of like tapeworm or even like lice or ticks. There are different classifications of bacteria. There are sphericals or cocci-shaped, rod-shaped are bacilli, corkscrew are spirochetes. There are aerobic, which need oxygen to live, and then anaerobic that don't need oxygen to live. Then let's move on to organisms that may produce disease. So typically it's the amount of the organism, the virulence, so how strong it is to cause an illness, and then the competence of the person's immune system, length and intimacy of contact between person and microorganisms. Reservoirs, like I said, are the natural habitats where this pathogen thrives. So, for example, a pathogen can thrive in animals, soil, food, water, milk, inanimate objects. So it just depends on what it is. Common portals of exit are respiratory, gastrointestinal, the genital urinary tract, breaks in skin, blood, and tissue. Means of transportation or transmission are direct contact, indirect contact, vector, fomite, droplet, and airborne. Fomites are inanimate objects that can carry pathogens such as clothes, doorknobs, and things like that. Portal of entry are very similar to the portal of exits. Can be entry through cuts in the skin, to breathing in, can be, like a sexually transmitted disease that enters through genital urinary means. And then the susceptible host, it's the person that the pathogen enters, and in whichever way it does, can the host either fight it or will they be susceptible to it? And then knowing the components of the infection cycle, we can then figure out how to break that cycle in order to prevent infections and illness. The following are stages of infection. That includes the incubation period, which is when the organism is growing and multiplying, the time the pathogen invades the body, and the appearances of certain symptoms can happen of an infection. The prodromal stage is when the person is most infectious. Vague and nonspecific signs of disease. The period lasts from several hours to several days. During this phase, the patient is often unaware of being contagious. The full acute stage of illness, present as specific signs and symptoms appear. The presence of the infection is specific, and there will be specific signs and symptoms. For example, if the infection is on a laceration, then that's when swelling is occurring and the patient is feeling pain. They might, if that infection is any deeper, they might have fevers and have symptoms that are of a full-blown infection. The convalescent period is the recovery from the infection. Convalescence may vary according to the severity of the infection and the patient's general condition. And if you think about it, knowing the stages of infection can help prevent the spread of infection. Incubation period and prodromal are typically where the pathogen is most virulent and easy to spread. This is why when someone is feeling ill, those first couple of days are really contagious, and we want them to stay home. We don't want them to go out in public so they can spread the infection. Think about how COVID-19 worked and how easy it spread, because a lot of the times people were in the prodromal stage and they were still out in public and doing things, and they were able to continuously spread the infection without knowing that they were actually doing that. So who's at risk for infection? Well, a lot of people are at risk for infection. We all are, technically, because we're exposed all the time. However, there is a susceptibility. Some people are more susceptible to pathogens than others. For example, those with weakened immune systems, patients who are hospitalized. Age is a factor as well, a risk factor. If you're thinking really young and really old, there are likely susceptible due to their either weakened immune system or immature immune system. And then patients with indwelling devices such as catheters, IVs, and central lines are highly at risk for infection. In your textbook, they describe all the different host susceptibility. So think of skin integrity and mucous membranes, which protect the body against a microbial invasion. Even pH levels of the GI and GU tract as it can change, either make you susceptible or not. For example, GU conditions such as yeast infections or bacterial vaginosis are changes in pH levels that allow the candida for a yeast infection to grow, because there is always little amounts of yeast present there, but a change in pH levels cause it to increase and thus causing an infection. Integrity and number of the body's white blood cells, which provide resistance to certain pathogens, help prevent infection. Age, sex, and heredity can influence susceptibility. Like I said, neonates and older adults can be more vulnerable. Immunity, natural or acquired, acts to resist infection. Levels of fatigue, nutritional and general health status, the presence of pre-existing illnesses, previous or current treatments, and certain medications can play a part in the susceptibility of a potential host. Think of patients who are undergoing chemotherapy. That medication weakens their immune system, thus making them more susceptible. Stress is actually one of the biggest things that can make a person susceptible. Stress has a very adverse effect on the body, causing kind of like a discombobulation of the hormones and affects our body's normal defense mechanisms. And then the biggest thing in hospitals is the use of invasive or indwelling medical devices that can provide a portal of entry for disease-producing organisms. So how does the body respond to infection? So the body has two ways to respond, and sometimes it does both. It can be one or the other. One is acute inflammation and the other is an immune response. So the inflammatory response helps the body neutralize, control, or eliminate the offending agent and prepare the site for repair. It occurs in response to infection or injury, can be acute or chronic. There's a vascular phase, which includes vasodilation, which increases blood flow, that causes redness and heat. Histamine release causes permeability of vessels and protein-rich fluids to get to the site of injury, which causes swelling, pain, and loss of function. Then there's a cellular stage where leukocytes and neutrophils consume the debris of the damaged cells and then repair. In contrast, you have the immune response, which the body attempts to protect and defend itself. There's humoral immunity, which includes an antigen, which is a foreign material such as bacteria or virus that creates an antibody, and that's produced by the body in response to the antigen. Then there's cell-mediated immunity, which leads to an increase in lymphocytes that destroys or reacts with cells that the body recognizes as harmful. Both acute inflammation and immune response are a protective mechanism. They help protect the body, and they both try to protect from infection and injury. How do we as nurses provide interventions to break the chain of infection? I really like this graphic because it really does show kind of where and how we can break the chain of infection. So let's talk about infectious agents. The biggest thing we can do is identify and eliminate the pathogens. So as nurses, we can do this by proper disinfection, sterilization, and timely use of antibiotics and antivirals. Reservoir. Control or eliminate where the pathogen lives and multiplies. So keep environments clean, maintain proper hygiene, treat carriers of diseases. I like to think of that one as people who carry MRSA or MRSA may not necessarily know they carry it, but in hospitals, or at least some facilities, they test for the presence of MRSA, and patients who test positive, who may not be sick with it but carry it, are placed into a contact precaution room. For portal of exits, prevent the pathogen from leaving the host. Cover wounds, use masks, and practice hand hygiene to stop pathogens from exiting through body fluids, respiratory droplets, or the skin. For mode of transmission, it's a way to disrupt the way the pathogen spreads. So obviously using proper hand hygiene, disinfecting, practice safe food handling, and employ barrier methods like gloves, gowns, to prevent that mode of transmission. For portal of entry, you want to block the pathogens from entering the new host. Maintain skin integrity. Use sterile technique for invasive procedures. Ensure wound care to prevent pathogens from entering. Using dressing, using dressing changes, or ensuring that dressing changes are occurring at a proper interval. Susceptible hosts, you want to increase the host's resistance by promoting good nutrition, getting vaccinated, stress management, adequate rest, ensuring that they are staying away from sick people if they have low immune systems and things like that. Here's some common laboratory data that can indicate an infection. So elevated white blood cell count, normal typically 5,000 to 10,000. An increase in specific types of white blood cells, elevated erythrocyte sedimentation rate, and then the presence of pathogen in urine, blood, sputum, or drainage cultures. And speaking of cultures, these are laboratory tests that are taken from where they think there is a pathogen to see if they can grow it on a petri dish. They'll do what's called a culture insensitivity test, which grows the pathogen, and then they test out different medications to see what medication will help. And typically it's an antibiotic, but which one will be the most helpful in treating that pathogen. And I forgot to change the slide, but here is your laboratory data. So let's talk about multi-drug resistant organisms. These are organisms that are resistant to multiple antibiotics in order to prevent them. What happens is that they're exposed to antibiotics and then they mutate and they create a resistance to antibiotics. Common ones are named here: methicillin-resistant Staph aureus, which is also known as MRSA. And then we have vancomycin intermediate-resistant Staph aureus, or VRSA, or vancomycin-resistant Staphylococcus aureus. Oh, sorry, the other one was VISA, and then this one is VRSA. And then there's vancomycin-resistant enterococci, and that one is VRE. And then there's carbapenem-resistant Enterobacteriaceae, which is CRE. And then Acinetobacter baumannii, CRAB. And very common one seen in the hospital is Clostridium difficile, which also has resistant properties. The biggest thing about these multi-drug organisms, they're pathogens that have developed resistance to multiple antibiotics, making them difficult to treat. When these infections are difficult to treat, patients are very, very vulnerable, and suffer, and they can actually die from these types of infections. The biggest thing with MDROs are antibiotic stewardship, which refers to the coordinated efforts to optimize the use of antibiotics to combat MDROs, ensuring that the right drug dose and durations are used for the right infection. This helps to slow the development of resistance and preserves the effectiveness of antibiotics. Nurses can play a critical role in this stewardship. First is the nurse needs to administer antibiotics as prescribed, ensuring the correct dosage and timing to maximize efficacy. They must educate their patients on the importance of completing the entire course of antibiotics, even if they feel better. Monitoring side effects for these antibiotics and reporting them promptly. Advocating for cultures and lab tests before starting antibiotics to ensure the correct treatment is chosen. And then promoting infection prevention practices like hand hygiene, isolation precautions to prevent the spread of MDROs in a healthcare setting. By actively participating in antibiotic stewardship, nurses help reduce the spread of MDROs and preserve the efficacy of antibiotics for future patients. MDROs are a growing problem in the world. We are just not making antibiotics as quickly as we can to combat these multi-drug resistance. And this is just a few. There are multi-drug resistant tuberculosis, STDs. So it is a problem that us as nurses can help. Healthcare associated infections, or HAIs, are those infections that patients acquire while receiving treatment in a healthcare setting, such as hospitals or long-term care facilities. Common HAIs include catheter-associated urinary tract infections, or CAUTI, surgical site infections, SSI, central line-associated bloodstream infections, CLABSI, invasive healthcare associated and hospital onset MRSA, and C. diff infections for those that are hospitalized. These infections can lead to increased patient morbidity, prolonged hospital stays, and higher healthcare costs. They are often caused by bacteria, viruses, or fungus transmitted through contaminated hands, surfaces, and medical equipment. Preventing HAIs in nursing includes hand hygiene, which is one of the biggest things. Nurses must consistently wash their hands before and after patient contact. Aseptic technique, using sterile techniques during procedures like inserting catheters, central lines, and dressing wounds to avoid introducing pathogens. The proper use of personal protective equipment, so ensuring that you know which precautions somebody is in and wearing the appropriate gear. Device management, so catheter care, avoid unnecessary catheterization, use sterile technique, ensure proper maintenance of the catheter. Central line care, follow strict protocols for the insertion, care, and removal of central lines. Ventilator care, so this is for your hospital-acquired pneumonias or VAPs for ventilator-associated pneumonias, but ensuring the head is elevated, providing oral care, ensure proper suctioning to reduce the risk of the ventilator-associated pneumonia. Environmental cleaning, so ensuring that the patient areas and equipment and surfaces are properly disinfected for the removal of potential pathogens, using appropriate isolation precautions, which I talked about earlier, and then patient education, patient and family education. So instruct patients on infection prevention techniques such as wound care, hygiene, and the importance of reporting signs and symptoms of early infection. So asepsis. Asepsis includes all activities to prevent infection or break the chain of infection. Medical asepsis is a clean technique to reduce the number of pathogens, such as hand hygiene and wearing gloves, versus surgical asepsis, which is sterile technique to keep the area free from microorganisms. Sterile technique is key and crucial in skills such as inserting an indwelling urinary catheter or inserting a central line. So this is crucial, so that you must know the difference between medical asepsis and surgical asepsis. Per the World Health Organization, these are 5 moments for hand hygiene. Moment 1, before touching a patient. Moment 2, before a clean or aseptic procedure. Moment 3, after bodily fluid exposure. Moment 4, after touching a patient. Moment 5, after touching a patient's surroundings. Other things I can think of are when your hands are visibly soiled. So hand hygiene should be performed right before you put on gloves and then after taking off your gloves. All right, let's do check. This is actually kind of like a review. So standard and transmission-based precautions. So we know standard precautions are what we used to call universal precautions. It's everything we provide to all patients, whether they are sick from an infection or not. So this is washing hands, wearing gloves, ensuring we're cleaning surfaces, and ensuring that we're using proper techniques for specific skills. A newer thing is now called respiratory or cough hygiene, and this is just teaching your clients or your patients to cough into a tissue or in their elbow so that they're not spreading any droplet type transmission pathogens. Let's see. And let's see here. We have contact precautions. So it will include all your standard precautions and then include a private room. You're required to wear gloves and gowns. There are special contact precautions such as the one with C. diff where you're required to use bleach-only products and you have to ensure you're hand washing instead of gelling for C. diff precautions because the alcohol-based hand hygiene does not kill C. diff. Droplet precautions include all the things from standard precautions. Private room, you'll require to wear a mask and gloves. And then there's airborne precautions, which also includes all the standard precautions. You're required a private negative pressure room. You're also required to have a particulate mask, such as an N95, gown, gloves, and then special airborne precautions / contact precautions is COVID, because with an active COVID infection, the patient is required to be in a private room. You're required to wear a shield or something to cover your eyes, and your N95 gown, gloves to prevent the spread of COVID-19. So this is just kind of a review because it has to do with preventing infections. All right, so let's take a look here. This is our nursing process, clinical judgment for infection. So some assessment data or recognizing cues that you might see are fever, pain, tenderness, open wounds or incision, redness, swelling, tachycardia, malaise, and elevated white blood count. Based on the information or the data you collect, you're going to analyze the cues, and based on that information, you can make an inference that your patient has an infection or they're at risk for an infection. Make sure you're clustering your data to properly analyze your priority problem. Next up is your priority hypotheses. And this one is infection. And then your planning, generate a solution. Client will remain free of infection. The client will maintain or restore its defenses. The client will alleviate or reduce problems associated with an infection. And just remember your planning. This is because it's a general and it's not a patient that we're taking care of. My planning or outcomes are not set up as SMART goals, but anytime you're planning care, you need to use the SMART goal format. Implementations or actions to do. So this is where you want to first do all your nursing actions, right? So you're going to assess and early detection, vital signs. You're going to ensure you're washing your hand. You're going to ensure you're educating your patient on infection and how to prevent it, how to report signs and symptoms. You're going to provide patient hygiene, and then you move on to your collaborative things such as medications, labs, tests like cultures, and those are collaborative or your provider needs to order them. And then we move on to evaluation, and at the evaluation portion, we are evaluating our goals. So did the patient remain free from infection? Are they able to restore their defenses? We're going to evaluate any educational goals we had for them. We're going to evaluate their decrease of signs and symptoms based on the interventions we provide. All right, so this looks like we're done. We are done with our infection and asepsis lecture. Please come to class with your questions. Thank you. Have a good day.